Hello and welcome to the Pediatric Nursing Journal podcast series. This series provides extended content relating to articles published in the journal, such as author interviews and roundtable discussions. Before we get started, we have a special offer for our listeners. You can save 50% off 1- and 2-year subscriptions to pediatric nursing. Simply visit pediatricnursing.net, click subscribe, and enter promo code PEDSAVE50 to take advantage of this special discount. In this episode, Dr. Judy Rollins, editor of Pediatric Nursing, talks with Dr. Elaine Musselman, the recipient of Pediatric Nursing Journal's 2020 Donna Wong Writers Award. Her winning article, Racial Ethnic Differences in Oral Health Knowledge and Practices of Preschoolers' Parents, was published in the January-February 2020 issue of Pediatric Nursing. Dr. Musselman discusses the key points of her article regarding childhood oral health. Tooth decay is a preventable yet common chronic childhood disease that affects children's nutritional intake and their ability to speak, play, concentrate, and succeed in school. Pediatric nurses have the opportunity to promote children's oral health by educating parents and providing anticipatory guidance on dental caries prevention when caring for children in schools, clinics, and acute care settings. Oral health education should be provided to parents in the language spoken most frequently by recipients and when children are infants, in the hopes of preventing dental caries on primary teeth. We are pleased to present Dr. Rollins' interview with Dr. Musselman.
Hi, I'm Judy Rollins, editor of Pediatric Nursing, and it's my pleasure to welcome Dr. Elaine Musselman, Associate Professor and Director of the School of Nursing at San Francisco State University in San Francisco, California. Welcome, Dr. Musselman, to this episode of Pediatric Nursing Journal's podcast series.
Thank you so much for having me.
Dr. Musselman is the winner of Pediatric Nursing's 2020 Donna Wong Writers Award for her article, Racial Ethnic Differences in Oral Health Knowledge and Practices of Preschoolers' Parents. And this article appeared in our January-February 2020 issue. Again, congratulations.
Thank you.
I understand from your article that tooth decay is now being considered a disease. Can you tell us just how serious a problem tooth decay is in children?
Sure. So tooth decay, also known as dental caries, is one of the most common chronic childhood diseases. It's actually 5 times more common than asthma. And research shows possible associations between oral health and diabetes, heart disease, premature births, and low birth weight. In 2020, approximately 23% of children ages 2 to 5 years and 56% of children aged 6 to 8 years had dental caries. And children of color are 2 to 3 times more likely to experience dental caries than white children. So when children develop caries, the bacteria is interacting with sugar in foods and beverages, turning them into acids which dissolve the tooth enamel. So this process continues through the tooth, causing pain and possibly the loss of the tooth for the child if that process is not stopped. So applying fluoride varnish is one way that we can protect the enamel and help prevent caries. And the tooth pain that children have from these dental caries can lead to problems eating and speaking, which is important for children. Research shows that poor oral health is significantly associated with school absenteeism and poor academic performance. Children who only go to the dentist when they're in pain frequently develop anxiety and a reluctance to visit a dentist even for preventive care. So this can actually continue into adulthood. So although children lose their primary teeth, caries on these primary or baby teeth is a significant risk factor for caries on the child's permanent teeth, which is why we need to protect those child's primary teeth.
So we really need to get the word out. Yes.
Yes, and I appreciate this opportunity to do that.
Yes. So what led to your interest in pediatric oral health, specifically the racial and ethnic differences, which you did mention a bit in your last statement there?
I actually became first interested in the pediatric oral health when I was working with our nursing students during their pediatric clinical rotation, and we were at Head Start sites in San Francisco. And I was surprised by how many children under the age of 5 had caps on their teeth. I had never seen that before. I looked in the literature and there was evidence that low-income children and minorities were disproportionately affected by dental caries. The CDC reports specifically that Hispanic and non-Hispanic Blacks have a higher prevalence of dental caries in children aged 2 to 5 years. And I was seeing the Asian children with caries, and I was curious as to how widespread this problem was in our city. So I was fortunate that one of our public health nursing faculty also works with the San Francisco Department of Public Health. And so he recommended I speak with members of the San Francisco Oral Health Initiative. It's now known as Cavity Free SF, to learn more about oral health of children in San Francisco. And so that was the beginning of my real interest in oral health and working with Cavity Free SF. And I now actually chair their Access Innovation Team, where we promote access to oral health services for San Francisco children and pregnant women outside of traditional dental settings.
Oh my goodness, that's wonderful. That's just wonderful.
They're quite a highly effective organization.
Great. Tell us a bit about your study that you reported on in the article.
Okay, so in my study, I collected data from Head Start sites in neighborhoods that were primarily Asian, Hispanic, or African American. I was interested in what oral health knowledge the preschool parents had and how that translated into practice. And then if there were differences between the three racial ethnic groups. So most parents knew children could get cavities on their baby teeth. They know they should be brushing their child's teeth, but they didn't realize that cavities on the primary teeth really do affect the child's permanent teeth. So once again, another message we can get out to them in their education. In my study, there was a consistent disparity in oral health practices of the Asian participants, which is what I had seen when I took the nursing students there to their centers. Asian children had their first dental visit at older ages than other ethnic groups, had the highest percentage of never flossing, only brushing once a day, never or only sometimes using toothpaste when brushing, which was very interesting for me. Another interesting finding was the number of parents who used toothpaste but didn't use fluoridated toothpaste. And it was only 15% of our sample, but it's such an easy way for parents to protect their child's teeth. And it's easy to include the need for fluoride toothpaste in conversations with parents.
Hadn't thought about the fluoride issue in the toothpaste. I guess I feel like it's in most toothpaste these days, but I guess not.
I actually had to look at the store to see that they actually do sell.
Okay. So I'm wondering, have you thought about repeating similar research with other populations?
Actually has. I think additional research is important. We know that the earlier oral hygiene becomes a routine part of caring for a child, the less likely children are to have dental caries. My study looked at children ages 3 to 5 years. I was set to start a similar study with parents of children 6 months to 2 years attending early Head Start in San Francisco. But unfortunately, the pandemic's delayed data collection, so I have not started that study yet. Another population I'm interested in and needs more research also is looking at children with special healthcare needs who also have difficulty maintaining their own oral hygiene.
Oh, yeah. Well, let's hope we can get enough of this pandemic behind us soon so you'll be able to get back out there. It seems to me that many healthcare professionals don't really think about dental health when they think about the total care of a child. How much are nursing schools and medical schools trying to address this, if they're addressing this at all?
Well, fortunately, they are addressing it. We didn't do such a great job not too long ago. We're changing. We still do have a long ways to go from here. But for example, in a 2009 survey by the American Academy of Pediatrics, 90% of pediatricians reported it's important to examine children's teeth and discuss preventive oral health care, yet only slightly more than half of those pediatricians actually examined the teeth of more than half of their patients that were 0 to 3 years of age. And only 4% reported applying fluoride varnish. So that percent's increasing, mainly due in part to the U.S. Preventative Services Task Force recommendation in 2014 that medical providers apply fluoride varnish during well-child visits for children through 5 years of age. So there's been a big push for them to do more, and they are doing more. Like I said, we still have a long ways to go. Most children under the age of 5 years have a medical home they go to for well-child visits, but not every child has a dental home. So by including oral health in those well-child visits, it presents the opportunity for pediatricians not only discuss oral health, but encourage families to establish those dental homes. People tend to look at medical care very separate from dental care, when we really need them to be together, and not we pay for medical care and we ignore the dental. Medical schools are now teaching oral health. It's required in the American Pediatrics Residency Education. The American Association of Colleges of Nursing includes oral health education as part of their Essentials of Nursing Education, which guides all nursing programs in the U.S. So we're seeing more collaborations between dental schools, medical schools, and nursing programs. For example, in San Francisco, the University of California, San Francisco's dental school collaborates with students in their nursing programs. Students in San Francisco State University's Family Nurse Practitioner program partner with dental hygienists to provide dental exams and fluoride varnish to children in the San Francisco School District and Head Start sites. So there's more going on than there was before.
Well, that's certainly good news. How about efforts in schools and communities? I know you're involved with that and have talked a bit about it.
One of the key things is providing that oral health education services where children are. In schools, daycare centers, this eliminates some of the barriers that we see to children receiving oral health services at dental homes. Parents don't have to take time off from work, which is a real barrier for low-income families to getting their children to a dentist. And there's no transportation concerns, which is another barrier for those families. It's often difficult for parents to get an after-school appointment. And so by bringing that oral health services to children at school, children don't have to miss school to go to the dentist. Inclusion of oral health services at neighborhood health fairs is another avenue for bringing the oral health care where children are at, and Head Start holds health fairs every year. A lot of these things have halted due to the pandemic, but we're slowly bringing them back. Public service announcements, banners in key areas of neighborhoods, messaging on city buses are some other ways that communities are getting involved in really promoting oral health for the children in their neighborhoods.
That's great. That's so good to hear. I imagine there may be many important oral health issues on the systems level. Can you speak on that for us?
Sure. Addressing oral health disparities, achieving health equity cannot be achieved by a single policy, program, government agency, institution, or community organization. The number of dentists that accept Medicaid patients and are willing to see children under the age of 3 doesn't meet the needs of our low-income and minority pediatric populations. With the U.S. Preventative Services Task Force recommendation, the inclusion of fluoride varnish on the Academy of Pediatrics periodicity table, fluoride varnish is now reimbursed, so there is a little bit more of an impetus to actually see these children. However, it's hard to become a Medicaid provider, and there's a low rate of reimbursement. That can be problematic. So there's guidelines, standards, and partnerships that are needed. The capacity of school-based programs to provide oral health services depends on getting parental consent, the availability of dental care providers who will go into the schools. And another key component is care coordination. Providers having access to the same information, ensuring the child receives the right care at the right time in the right place. Just giving a parent, a referral for their child to go to the dentist for caries. Does the child ever make it there? Is there any follow-up to what is going on with the child? Do they have transportation there? Is it covered? So really addressing those from more of a community and bigger picture than just, do you have a dentist?
Yeah, it's a huge issue. Is there anything else you'd like to add as we're coming to a close?
I think it's important that oral health is really integrated into overall health, and that's how it's viewed. This is a time for all healthcare providers to really step up and work together to achieve the optimal oral health for our children. The inclusion of oral health and anticipatory guidance at well visits, clinic visits, schools, acute care settings is key to reaching and identifying children at a high risk of oral health problems. And it's important to have the conversation early because dental caries are preventable. We need to start with the baby teeth.
Thank you so much, Dr. Musselman, for sharing your time and your expertise today with us. Thank you again for the important work you're doing.
Thank you for having me.
The Pediatric Nursing Journal podcast series is owned and produced by Genetti Publications Incorporated. All rights reserved. No portion of this podcast may be used without written permission. Dr. Elaine Musselman is an assistant professor and associate director at the School of Nursing, San Francisco State University in San Francisco, California. Her award-winning article, Racial Ethnic Differences in Oral Health Knowledge and Practices of Preschoolers' Parents, was published in the January-February 2020 issue of Pediatric Nursing. Dr. Judy Rollins is the editor of Pediatric Nursing and president of Rollins & Associates Research and Consulting in Washington, D.C. For archived episodes of this podcast and to learn more about pediatric nursing, visit the journal's website at pediatricnursing.net. You can also subscribe to Pediatric Nursing Journal podcast series on Apple Podcasts, Google Podcasts, Spotify, Stitcher, TuneIn Radio, our hosting site Spreaker, and everywhere you get your podcasts. And remember, as a listener, you can save 50% off a 1 or 2 year subscription to pediatric nursing. Simply visit pediatricnursing.net, click subscribe, and enter promo code PEDSAVE50 to take advantage of this special discount.